Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter. Today I'm going to be talking about something very important at this time of the year. I'm going to be talking about colds, flus, and a little bit about pneumonia. Mainly, what I'm going to be talking about is how to tell the difference between a cold and a flu. Because at this time of year, it's very important to know the difference because one is perfectly normal. Well, being sick is never normal, but one is okay and the other could be very harmful. So, before I start out though, I want to say a quick thanks to a YouTube user that contacted me and didn't hesitate to ask me a question. And I just wanted to put it out there that that's what the purpose of this is. It's not only for me to share my knowledge with you, but for you guys to be able to ask me questions if you feel like you need to. So I just want to thank Hector Selena for contacting me and not being afraid to ask any questions. Okay, so let's get right into it. Cold versus flu. So, as we all know, colds, they suck. They really do, because they're so annoying. It's not really enough to give you a sick day, but you go to work or you go to school and you feel like crap. It's not fun. People usually get them once a year, twice a year sometimes, but you usually get them around this time of year, and it sucks. But the flu is a lot more harmful. It's more severe, and for certain people, it can be potentially deadly. And I'm not even just talking about swine flu, I'm talking about seasonal flu. So, just because it's not that pandemic H1N1 flu that everybody was so scared about last year, doesn't mean that it is not harmful and it is not potentially deadly. So, how do you tell the difference between cold and a flu? Because they can look similar, and if you don't really know what you're looking for, you might think you have a cold and you might actually have the flu. But trust me, if you have the flu, you know you have the flu. So, I'm going to go through, and I'm going to go through the symptoms that you would think of for both of these. I don't want you to think I'm reading off a script, but I want to make sure that I get this right, because I don't want to say anything wrong, and then have you guys base your assessment of yourself off of a wrong video. So, I have it written down on a little notepad. Fever. Everybody thinks, oh, if you have a cold, you have a little bit of a fever. Well, yeah, you might have a low-grade fever, 99, 100, but rarely in a cold are you going to have an actual real fever. Whereas in the flu, you usually do, and it sometimes it can go high. You usually see anywhere from 101 to 103. If you're seeing any higher than that, you should really go to the ER, because you're getting into a dangerous temperature zone. Okay, so aches, body aches, oh, your muscles are so sore, you can't move. When you have a cold, you can feel that muscle ache when you're just getting up in the morning, moving around, it just kind of feels slow. Whereas with a flu, oh, you get severe muscle aches and they kill. I just had the flu last year, so I know they're so achy. It's just everything you do just hurts, and it's not like somebody stabs you. It just feels so crampy and achy. You don't want to do anything. Chills. In a common cold, you don't usually see it. It's very uncommon to see it. Whereas in the flu, you can get shaking chills with fevers, and it shakes your whole body, and if you can't stop, you're shaking as if you're freezing cold. Fatigue or being tired. When you have a cold, yeah, you're gonna feel tired, and you're gonna feel that feeling of just not feeling right, also known as malaise. With the flu, you're gonna be very, very tired, like so tired that you can't get out of bed. It'll tie you up in bed for a while, and you just want to sleep, and that's all you can do is sleep and sleep. You need that rest. It's not oh, I don't feel well, I feel kind of tired. It's I am so tired, I cannot get out of bed, tired. The onset, or how fast the symptoms come on. With a cold, we have what's called the rule of 3. So, from the time you come in contact with the virus, a cold virus, you have 3 days until, like, for the virus to what's called incubate, which is where it gets into your body, it settles in, it finds a home, and then it starts causing problems. So 3 days, and then you have 3 days of those yucky symptoms that everybody hates. Oh, you feel kind of tired, sneeze, coffee, everything's just bleh. That's when you feel like the worst symptoms of the cold. And then you have 3 days of those lingering symptoms. You feel a little bit better, but not 100%. So, rule of 3. Now, you might have a little bit of a runny nose or lingering cough that tends to linger for a week or two after that, but rule of 3. Now, the flu, it's not that gradual of an onset. From the time you come in contact with the flu virus, you can expect to see symptoms very quickly, sometimes within 3 to 6 hours, and they come on fast. When they say you feel like you got hit by a bus, you do. And it happens just that quickly. You just, bam, hits you. So, coughing, it happens in both, but there is a difference in the kind of cough that you're going to be experiencing. If you have a cold, most likely you're going to be coughing phlegm up. Blah. You're going to be coughing a lot of mucus up. Blah. Whereas with the flu, you're going to be coughing, but you're not going to be bringing anything up. More than likely, it's going to be a very dry cough. And just to let you know, when people say, oh, what color is your mucus, that's kind of a fishwives tale. The color of your mucus doesn't necessarily have anything to do with the state of your illness or what kind of illness you have. The only color you want to be aware of is if you see a rusty brown color or red in your phlegm. Not necessarily your nose, because you can get nosebleeds, but in the phlegm that you cough up from your lungs, if you see rusty brown or red, you want to be going to the ER or your physician, because you got something more than just the cold or the flu going on. Okay? Alright, so sneezing. Sneezing is very common with a cold. That's all you do. Achoo, achoo, achoo. And the flu, you're not really sneezing that much. Maybe a little here and there, but not very much. Same thing goes for stuffy nose. You're going to have very stuffy nose when you have cold a lot of the time. That's why people come in to get decongestants in the pharmacies. But you don't see that much in the flu. And the same thing goes with the sore throat. Sore throat is the first thing you feel with a cold a lot of times. You wake up, you feel like you're swallowing knives. You don't really get that with the flu. It's very uncommon. Chest discomfort, you feel like, you feel very like somebody's sitting on your chest, that kind of feeling. You just feel tight and everything. Not the kind of tight that you get when you're feeling a heart attack, but you can feel that. Like it's hard to breathe, almost. This can range anywhere from mild to moderate with a cold, depending on how much stuff you're coughing up. You might feel like you got some stuff stuck there, but with the flu, you're going to feel a lot of chest discomfort. You might even feel a little short of breath from it. And last thing with cold and flu is a headache. You see that kind of complaint. With the cold, you don't normally see it. The only thing you might feel is like pressure headaches from being stuffed up, and that's different. But with the flu, you're going to get headaches. They're more common, and just feel headachy. It comes with the whole being tired and achy and everything. They all just kind of lump together. So those are the symptoms, and which is which. I'm going to put a link to a website where they explain it, and they put it out in a chart, and it'll be down below in the information bar. So yeah, just be aware they have similar symptoms, but it's a completely different presentation, and it's very important to know which it is that you're experiencing. Because like I said, colds are annoying. They come and go. There's not really much you can do. It changes so frequently, the virus itself, that we can't come up with a cure for it. So you just kind of have to treat the symptoms and wait it out. You kind of have to treat the symptoms based on what you're experiencing, and for that kind of thing, you can just go right to your local pharmacy and ask them what they recommend, if it's Sudafed or Benadryl or Claritin. It all depends on the symptoms you're experiencing. Most colds can easily be aided with the help of some Sudafed, and Roma doesn't. So, but if you have the flu, or if you think you have the flu, you want to go to your doctor, because if you've just gotten it, there's a chance that we can give you something called Tamiflu, which if you catch the flu within 48 hours, you can help shorten it by a great number of days. So if you think you're experiencing the flu, please get in touch with your doctor. So, the flu is the thing that we see kill people every year. Every year thousands of people die from the flu. Some years more than others, but yeah. So, who's at risk for dying from the flu? Well, the extremes of age, the very young and the very old, is where we're going to see most deaths hit. But also, pregnant women have a lot more risk, and they have a lot of risk to the baby that they're carrying. And any kind of person has a health condition that really affects their immune system. So let's say you have cancer and you're getting chemotherapy. Chemotherapy completely depletes your immune system, and so you're more at risk for having a more severe infection, just in general. Same thing goes for, let's say, HIV patients. People taking immunosuppressant drugs for rheumatoid arthritis, things like that. Anything that depletes your immune function, that's going to put you at a higher risk from having more complications from the flu. And one of the complications that can come from the flu, or even a cold for some people, is pneumonia. And pneumonia is completely different. It's a lot more severe. That's something that you don't want to sit and wait. If you think you have pneumonia, you want to go right to your doctor. Sometimes it's so severe that you have to be put in the hospital and be given IV antibiotics. And now, the reason this is linked to cold and flu is not because the cold and flu turns into pneumonia. I hear that all the time, and I hear older people say it, or just people saying, oh, well, I better get this cold under control or it's going to turn into pneumonia. The cold and the flu are viruses. They do not magically turn into the pneumonia bacteria, because most of the time pneumonia is caused by bacteria. So that's not how it works. But the reason it's linked is because you get a respiratory infection, whether it be the cold or the flu, and your body's busy fighting off that. It's really fighting. It's your immune system is down because you're busy trying to get rid of this infection that you have. And in walks a little pneumonia bacteria. It gets into your lungs. You already have a little bit of depleted immune system because it's busy going haywire. And it just settles in your lungs and then starts to multiply. And that's how it happens. It's not that one turns into the other. It's that one is busy with your immune system and the other has a chance to strike. It's more or less why they're linked. But pneumonia is very severe. Pneumonia can be life-threatening, especially for those for the at-risk groups that I named before for the flu. It's even more so with pneumonia. So you want to be very careful. Common symptoms of pneumonia include a very wet cough, where you're coughing up stuff, and that's a lot of times. Sometimes we'll see blood in phlegm. Sometimes that's where people claim they see green phlegm, but like I said, that color doesn't necessarily matter. Also, you got fever, shaking chills, shortness of breath, more severe than with the flu. And for older people, mental status changes, which is a technical term for when you just kind of feel confused. It's not that you're going senile. You feel confused. You can't figure out what's going on. You're kind of just like in a daze and a fog, and you just can't think right. And a lot of people that are with somebody that goes through these mental status changes claim that the person's acting weird if they're just not with it. that's kind of the confusion that we're talking about. They might not be sure of, the day. They're just kind of in a fog. You see that with a lot of older people, and that's because people's immune systems aren't as active as they get older, and so they don't have as strong of a response to an infection, and so the only thing you see sometimes is person's confused. Their behavior completely changes. Alright, so if you're experiencing any of these symptoms and they are severe, you need to see a doctor, whether it be your physician or you go to the emergency room. One or the other. A trip to the pharmacy is not going to do it. You need to see a doctor. So, here we are in cough, cold, and flu season. How are you going to prevent it? What are you going to do? Because you surely don't want to get it, trust me. So, tips on prevention. I have 4 or 5 tips. Okay. 1. First off, eat right. Get lots of rest. 2. Hand washing. Even though cough, or a cold, the flu, and even pneumonia are spread by respiratory droplets, meaning if the person breathes on you. Say you go to a public restroom and you open the door. The door right before then had been opened by someone who had touched their nose, and they have the flu. You touch that doorknob, you don't wash your hands, and then you go like this and rub your face. Guess what? You just inoculated yourself with influenza. Have fun. 3, try not to rub your eyes or put your fingers in your mouth or anything like that throughout the day. 4, avoid contact with people who are sick. Just because they don't have it severe doesn't mean you won't have it severe. So if you can avoid contact with sick people, at all costs, please do. And please don't share drinks or food or anything like that. And 5, get your annual flu shot. Unless you, can't receive the vaccine for allergy reasons, I would suggest that you definitely get it. And to help prevent pneumonia, you should look into getting the pneumonia shot if you're over the age of 65 or you have certain health conditions. So, that's pretty much all that I have to say today. Know the difference between the cough, or the cold and the flu. I keep calling it the cough. Ooh, that sounds really bad. No, seriously. Know the difference between the cold and the flu. Be aware that they have 2 completely different presentations. Like I said, cold can be managed by a pharmacist, flu managed by a physician. If you think that you have pneumonia, please see a doctor ASAP. It's a very serious matter. And just take care to prevent all of these as much as you can. Because who wants to be sick, really? Not only does it tie you up and put you to bed, but it can be deadly. Okay? This is a serious issue, and I just want to put this out here. Okay? So, please take care. Be safe. Stay healthy. Eat and drink healthily. Get lots of rest. Exercise. Be healthy. And I will see you all next time. Bye!